Hello and welcome to the TEHS AMS overview. The TEHS starts from the town of Elliott, which sits roughly on the 19-degree wet tropics line and extends up to Darwin and Gove. There are 3 population centers in the TEHS. Catherine, with a population of about 10,000, Gove, with a population of about 4,000, and Darwin, with a whopping population of about 136,000. You will notice that the population of the TEHS all sit up in the top end of the top-end health service, with very few people below Catherine. This puts us in a unique position. With only 2 regional hospitals and 1 primary referral hospital, we are relatively isolated from the rest of Australia. This means we have the power to maintain a healthy level of antimicrobial resistance. It also means that most of the resistant microbes we encounter are grown from top-end health service. Our microbiome is changing. Around 1 in 3 staph isolate, which presents to our hospitals, is a form of MRSA. To help prevent further resistance, you will be learning about how to prescribe antibiotics safely and effectively through this course along with our friend Dr. Rick.
Hello!
Dr. Rick recently graduated medical school. Rick is a strange guy. His hobbies include playing with his pet gecko and dressing them as well, and rating wet cat photos on internet, which unfortunately has led to low grades in antimicrobial prescribing. But that's okay, because with this short course, he can learn the basic of becoming a great antibiotic prescriber. First of all, microbiology should always guide therapy if it is available. Indications should be evidence-based. Check the PGC for an NT-specific guideline or follow the Australian therapeutic guidelines. If you can't find a recommendation for treatment on PGC or in the therapeutic guidelines, then you should phone IFD for advice. The narrowest spectrum agent possible should always be used. Just because an agent is broader spectrum does not necessarily mean that it is more effective. You should always use the guideline recommended dose and route for the type of infection. You should use oral antibiotics for infections in the GI tract and high doses in meningitis to allow penetration into the CNS. Minimize the duration of therapy wherever possible, especially for IV antibiotics. Antibiotics are not benign substances. They can cause line-related infections, promote Clostridium difficile infection, as well as cause liver and kidney damage.